Multiple choice questions, MCQs, on greater than Spinabifida with visual or intellectual impairment. Focus: causes, effects, mobility challenges, associated disabilities, teaching learning strategies, and classroom support. 1. Spinabifida is primarily a defect in the toys. A. Brain. B. Spine. C. Lungs. D. Eyes. E. Ears. Answer: B. Spine. 2. Which of the following is a common result of Spinabifida? A. Speech loss. B. Vision improvement. C. Paralysis of lower limbs. D. Hand tremors. E. Rapid growth. Answer: C. Paralysis of lower limbs. 3. Spinabifida occurs during A. Adulthood. B. Birth. C. Prenatal development. D. Toddler stage. E. Teenage years. Answer: C. Prenatal development. 4. Which part of the nervous system is affected in Spinabifida? A. Peripheral nerves. B. Spinal cord. C. Brain stem. D. Optic nerve. E. Cerebellum. Answer: B. Spinal cord. 5. A child with Spinabifida and visual impairment may have difficulty with A. Hearing instructions. B. Locating visual cues. C. Remembering music. D. Writing poems. E. Recognizing taste. Answer: B. Locating visual cues. 6. Hydrocephalus is a condition often associated with A. Visual impairment only. B. Spinabifida. C. Hearing loss. D. Tooth decay. E. Liver disease. Answer: B. Spinabifida. 7. Which of these is a common support need for children with Spinabifida? A. Braille books. B. Crutches or wheelchairs. C. Spectacles. D. Hearing aids. E. White cane. Answer: B. Crutches or wheelchairs. 8. Intellectual disability is characterized by A. Speech delays only. B. High IQ. C. Limitations in intellectual and adaptive functioning. D. Frequent colds. E. Long arms. Answer: C. Limitations in intellectual and adaptive functioning. 9. Which one of these is a key functional limitation in Spinabifida? A. Fine motor coordination. B. Heart rhythm. C. Eye blinking. D. Body temperature. E. Stomach acid. Answer: A. Fine motor coordination. 10. Visual impairment with Spinabifida can affect A. Cognitive reasoning. B. Social skills only. C. Orientation and mobility. D. Verbal fluency. E. Food habits. Answer: C. Orientation and mobility. 11. The exact cause of Spinabifida is A. Always genetic. B. Due to stress in pregnancy. C. Often unknown but linked to folic acid deficiency. D. Virus infection. E. Water contamination. Answer: C. Often unknown but linked to folic acid deficiency. 12. Spinabifida is a type of C. A. Cognitive disorder. B. Sensory disorder. C. Neural tube defect. D. Emotional disturbance. E. Psychiatric illness. Answer: C. Neural tube defect. 13. One early diagnostic tool for Spinabifida during pregnancy is A. MRI. B. Blood glucose test. C. Ultrasound. D. Eye test. E. Heart scan. Answer: C. Ultrasound. 14. Myelomeningocele is the A. Mildest form of Spinabifida. B. Most severe type of Spinabifida. C. Eye disorder. D. Muscle pain syndrome. E. Hearing problem. Answer: B. Most severe type of Spinabifida. 15. Folic acid supplementation during pregnancy helps prevent A. Hearing loss. B. Intellectual disability. C. Spinabifida. D. ADHD. E. Stuttering. Answer: C. Spinabifida. 16. Which of the following is not a symptom of Spinabifida? A. Weakness in legs. B. Difficulty walking. C. High fever. D. Curved spine. E. Bladder problems. Answer: C. High fever. 17. Visual impairment refers to a condition where A. Eyes remain closed. B. Light is not seen. C. Sight is partially or fully lost. D. Vision increases sharply. E. Eye color changes. Answer: C. Sight is partially or fully lost. 18. IQ below 70 is considered as A. Above average intelligence. B. Normal functioning. C. Intellectual disability. D. Giftedness. E. Reading disorder. Answer: C. Intellectual disability. 19. One of the complications of spina bifida may be A. Broken bones. B. Seizures. C. Hair loss. D. Stomach ulcers. E. Skin allergy. Answer: B. Seizures. 20. Children with spina bifida and ID are at higher risk of A. Overeating. B. Peer rejection and learning delays. C. Musical genius. D. Sudden weight gain. E. Advanced reading. Answer: B. Peer rejection and learning delays. 21. Children with spina bifida and visual impairment need A. More punishment. B. Shorter school hours. C. Orientation and mobility training. D. Swimming classes only. E. Auditory therapy. Answer: C. Orientation and mobility training. 22. Accessible classrooms for children with spina bifida should include A. Narrow doors. B. Stairs only. C. Ramps and wide entrances. D. Dark lighting. E. No desks. Answer: C. Ramps and wide entrances. 23. Children with visual and intellectual impairments may need A. Sign language. B. Audio-tactile learning materials. C. Written lectures. D. Language lab. E. Gymnastic practice. Answer: B. Audio-tactile learning materials. 24. Which assistive device helps a child with spina bifida in walking? A. Braille slate. B. Spectacles. C. Walker or leg braces. D. Earphones. E. Visual chart. Answer: C. Walker or leg braces. 25. Teaching methods for children with multiple disabilities must be A. Rigid. B. Textbook based only. C. Flexible and individualized. D. Competitive. E. Group only. Answer: C. Flexible and individualized. 26. Multisensory teaching involves A. Using only textbooks. B. Overloading information. C. Engaging multiple senses for learning. D. Limiting feedback. E. Only blackboard use. Answer: C. Engaging multiple senses for learning. 27. Children with ID and spina bifida may require A. More frequent assessments. B. Visual punishment. C. Curriculum acceleration. D. Short lectures with practical learning. E. Quiet seating only. Answer: D. Short lectures with practical learning. 28. Functional academics refer to A. Poetry and grammar. B. Sports. C. Daily life skills like money handling, time, hygiene. D. Classical literature. E. IQ testing. Answer: C. Daily life skills like money handling, time, hygiene. 29. Children with mobility and vision issues should avoid A. Clear floor spaces. B. Dim lighting and obstacles. C. Peer interactions. D. Simple routines. E. Group activities. Answer: B. Dim lighting and obstacles. 30. To support a child with spina bifida in the classroom, the teacher must A. Encourage independence and adapt the environment. B. Ignore medical needs. C. Focus only on exams. D. Keep them seated at the back. E. Use lengthy homework. Answer: A. Encourage independence and adapt the environment. 31. An important team member in managing spina bifida is A. Historian. B. Neurologist. C. Florist. D. DJ. E. Chemist. Answer: B. Neurologist. 32. Occupational therapy helps children with disabilities in A. Memorizing poems. B. Improving physical independence in daily tasks. C. Playing music. D. Doing art. E. Learning history. Answer. B. Improving physical independence in daily tasks. 33. Inclusive education ensures that A. Students are segregated. B. Everyone gets the same book. C. All learners are educated together with necessary accommodations. D. Weak students are removed. E. Only fast learners are rewarded. Answer. C. All learners are educated together with necessary accommodations. 34. Peer sensitization is important to A. Avoid bullying and promote empathy. B. Create discipline. C. Ensure competition. D. Increase silence. E. Separate students. Answer. A. Avoid bullying and promote empathy. 35. Parental involvement helps in A. School dropout. B. Enhancing consistency between school and home. C. Reducing child's IQ. D. Reducing creativity. E. Changing vision. Answer. B. Enhancing consistency between school and home. 36. IEP stands for A. Immediate Emergency Plan. B. Independent Educational Philosophy. C. Individualized Education Program. D. International Exam Policy. E. Internal Enrollment Process. Answer. C. Individualized Education Program. 37. A child using a wheelchair should have access to A. Uneven ground. B. Sloped ramps and elevators. C. Steep stairs. D. Low light. E. Overcrowded rooms. Answer. B. Sloped ramps and elevators. 38. Tactile learning materials benefit students with A. Intellectual disabilities. B. Visual impairments. C. Hearing loss. D. Speech delays. E. All of the above. Answer. E. All of the above. 39. Family-centered interventions focus on A. Treating parents. B. Involving families in therapy and decision-making. C. Ignoring home situations.